it's interesting to look at how people learn, what their learning styles are. 10% of, when people are told something, they will retain 10% of it. If you show them something only, they'll retain 35% of it. If you show and tell them, all of a sudden it jumps to 65%. So it's amazing how when you start to touch additional senses, how much more people retain. And you can only imagine how high the number is if you show, tell, and then they touch it. That's why we love using models in dentistry and letting people touch those physical things to illustrate what it is they're trying to change. So we need to use some of these tools more effectively to educate our patients, because if we do that, what that allows us to do is be far, far more effective in that process. And ultimately what we want to do is we want to move them through that process to, again, health, to case acceptance. And one of the challenges we find, and we just alluded to a little bit last week, was us portraying or pushing our morals, our views on the world on the patient. I don't believe this patient could afford this. I don't think this patient would value this. I don't think this patient wants the best. And I love this slide here regarding what people are willing to do. You know, there's always somebody who's willing to do it for cheaper. And if you look at that tattoo on that guy's shoulder, that person is not a very good artist, and compared to what they were expecting. So the challenge becomes when we're offering our patients treatment, I think what we need to do is we need to absolutely offer them the best. We have to be willing and able to back it up, so we're not drawing a little stick figure horse like I would draw on someone's back. And if we do that, then all of a sudden I would far rather, a quote I used a few weeks ago was, I would rather apologize for my price once today than spend a lifetime apologizing for poor quality, as is very powerfully portrayed in that picture I just showed. And I think that's a great overall theme when it comes to case acceptance. What can we do to get into this person's head to understand what it is they want? What can we do to present and educate them so they're willing to and wanting to increase their health and say yes to that treatment? And ultimately, it's about getting them to separate with their money, because your treatment is not free. If it was free, you would not be in business. Business, you have to make a living to be able to make payroll. So it's interesting when we start looking at some of these things. And I think, Shar, your point earlier of people being scared to death is a very valid point. Somehow we have to make them at comfort and at ease in this process to allow them to be open to being educated so they then can say yes to that treatment.
Correct. And the other piece behind that is also the commitment piece, right? You as the doctor, you bring an expertise to the table. You are committed in keeping your patients healthy. So as you are doing your treatment planning for the patient, be committed to carrying them through that whole process. It's okay to present the case acceptance up front, but then don't forget about the being committed part throughout the rest of the treatment. What I have seen is the initial piece, whenever the treatment's being presented to the patient, that commitment is there. But then it starts to fall away, so the patient doesn't see the importance of it after a while as well. So it takes commitment throughout the whole treatment plan.
Questioning obviously is one of the most important things when it comes to any process of motivation and change, because otherwise we're just lecturing to somebody. And anytime we're just lecturing to somebody, it starts to come across as nagging. You know, I love the offices that I wander into, and they're like, we've been talking to this patient about this procedure for like forever and they haven't done it. And my question to them is when you've been talking to them about it for the last 2 years, have you had the exact same conversation again and again and again and again? And they're like, yeah, why? And I'm like, why wouldn't you change something? Obviously it hasn't worked. And what's fascinating to me about that is we get in such a habit of just doing it the same way, and everybody thinks different. There's different learning styles for people, and we have to understand and appreciate that. And it's not that the patient's good, bad, or otherwise, it's just everybody's different. So it's important for us to be flexible enough in our approach that we can modify our approach, have a different conversation with that patient, because maybe for this person, they're not interested in the vanity side of it, but they're interested in the benefits of their overall health and what you can do for them in that regard. And the only way you're ever going to find those things out is by asking more and more questions. the challenge I find when it comes to asking questions and sitting down with a patient, probing questions, if you will, is we don't often want to take the time. We get in such a rush, we just want to run right in, have a 2-minute conversation, and expect that patient to pull out a credit card and swipe it for $10 or $15 or $20,000 and be on our way. And the reality of life is if we want to increase the size of our transactions, make them bigger transactions, we are going to have to slow down to go fast. And in that process of slowing down and spending the time with them and getting to know them and getting to know what's important to that person, it allows us to dig deeper into what their motivation is. Once we understand their motivation, then we can key in on that when it comes to our presentation and solve those problems for them. Otherwise, we're just selling stuff. And in dentistry, certainly nobody wants to be just selling stuff. Everybody makes that very, very clear. So if you don't want to just be selling stuff and you want to be a problem solver, you then need to slow down, take the time, get to know that person, and understand what's important to them. Understand what drives them, what excites them about life, and then help solve that challenge, because whatever it is that drives them, they want to get to point A or point B over here from point A. There's something that drives them there, and we have to understand what that is in order to be able to get them there. And without understanding that, we're just going to give them bad direction.